Hello everyone, myself Dr. Hepsiba. Today I give you an overview about refractive errors. Before we learn about refractive errors, just see the overview about the anatomy and physiology of eye. The eye is made up of three main parts, as we all know that is the eyeball, orbit or eye socket, accessory structures. Eyeball, that has outer layer is sclera and cornea, middle layer is iris, choroid and ciliary body. Inner layer is retina and lens. This is the picture which shows the structure of the eyeball. The parts were labeled over here, and it's a basic thing. It's already you all know about that. That is eye muscle, sclera, retina, lens, optic nerve, vitreous humor, and all the others are also choroid, ciliary body, and iris, pupil, cornea, and aqueous humor. I'm not detailing about this thing because it is a basic as you all learn from our beginning. Then lens. The lens is a transparent structure in the inner part of the eye which lies directly behind the cornea and iris. In the picture it is visible. The lens changes shape to allow the eye to focus on objects. As you know, when we are looking on the nearby object or the distant object, the structure of the eye it will change or accommodate according to the vision. The lens focuses light rays on the retina. So this is what the picture which shows how the lens and muscles accommodate when we are visualizing the nearby object and the distant object. Accessory structures of eye. The accessory structures are eyelid, pupil, croncle, iris, lacrimal gland, eyelash, sclera and conjunctiva. It is externally which protect our eyes. Then this section I am teaching about refractive errors. So we can see detail what is refractive errors, and first of all we see the terminology relating to that. First of all, emetropia. What is emetropia? Emetropia is optically normal eye. That is, a normal vision is what's said as emetropia. Can be defined as a state of refraction when the parallel rays of light coming from infinity are focused at the sensitive layer of retina with the accommodation being at rest. So that is a term known as emetropia. Another terminology is ametropia. It is a condition of refractive error. Is defined as a state of refraction when the parallel rays of light coming from infinity are focused either in front or behind the sensitive layer of retina. That is a situation where visual disturbance occurs. That is what we call it as a refractive error. That is when the light which is coming from infinity which fall behind or above the retina, that is the stage is ametropia, that is a refractive errors. We see detailedly about what are the types of refractive errors. First of all, myopia. It's a very commonly we all heard of this myopia. Myopia, otherwise it is called short-sightedness. So what is that? It's a type of refractive error in which parallel rays of light coming from infinity are focused in front of the retina when accommodation is at rest. So when light coming from infinity which fall front of retina, so that leads to myopia or short-sightedness. So this picture describes how myopia, that is light rays focus in front of the retina. So they have a blurry image, that is a blurred vision. So this picture also shows that this is a normal vision, how we see the object, and when is a myopia, how the vision is. Etiological factors of myopia. First one, axial myopia, which results from increase in the anterior posterior length of the eyeball. Because of increase in length of anterior posterior eyeball, that is leads to fall of visual rays front of retina. That is what one etiological factor is, axial myopia. Next is the curvatural myopia, which occurs due to increased curvature of the cornea, lens, or both. And another is the index myopia, results from increase in the refractive index of the crystalline lens associated with nuclear sclerosis. So these are the three etiological factors that leads to myopia, that is axial myopia, curvatural myopia, and index myopia. Then types of myopia, it is mainly three types: congenital myopia, simple myopia, and degenerative myopia. We see what is congenital myopia. Congenital myopia is present since birth. Usually the error is of about -8 to -10 diopters. So you may think of what is diopters. Diopters is a unit of measurement used for an eye prescription. The focusing strength of our glass or contact is measured in diopters. That is a unit of measurement of vision, which mostly remains constant. It may be associated with other ocular congenital anomalies. Second category is, or the second type is simple myopia. What does it mean by simple myopia? That is the most commonest type of myopia which result from normal is starts biological variation in the development of eye. Simple myopia starts at school age and very slowly progresses till adult age. Usually the error does not exceed -6 to -8 diopters. Then third type is degenerative myopia. Degenerative myopia, it is a pathological myopia or degenerative myopia, is a rapidly progressive error resulting in high myopia. So the measurement is more than -8 diopters. During early adult life, which is usually associated with degenerative changes in the retina, genetic factors play a major role in the etiology of pathological myopia. So, management or the treatment for myopia. So, here says concave lenses in the form of glasses or contact lenses. It is a option for management. That is a medical management or the medical corrections. And surgical management are radial keratotomy, photorefractive keratotomy, laser assisted in situ keratomelias. So, how radial keratotomy? That is a they make the incisions and they correct the lens. Second one is the photorefractive keratectomy. So they anesthetize or put an numbing drops over the eyes and it will soften the cornea. Then the surgeon smooth the surface of the cornea with a special surgical instrument. Then excimer laser is then used to precisely reshape the curvature of the cornea surface. Then finally, a bandage like soft contact lens is then placed on the cornea to help protect the eyes as it heals. So they correct the curvature or whatever the deformity through the photorefractive, that is a laser therapy. Next is a laser assisted in situ keratomelias. So they just creating the flap, that is the portion it is removed as a flap. Then through the laser they correct the curvature, then closing the flap. Second type of refractive error is hyperopia. Earlier we say myopia, that is a short sight. Here the hypermetropia or hyperopia, or it is called long sightedness, is a refractive state of the eye wherein parallel rays of light coming from infinity are focused behind the retina with accommodation being at rest. Thus the posterior focal point is behind the retina, which therefore receive a blurred image. So this is a picturization shows how this hypermetropia or hyperopia is the patients with hyperopia see the object. Etiological factor of hypermetropia. First one is axial hypermetropia. Is by far the commonest form. It occurs due to short axial length of the eyeball. Second one, curvature hypermetropia occurs due to the comparatively flatter curvature of the cornea or lens or both. Index hypermetropia results due to change in refractive index of the lens. Then absence of lens, either congenital or acquired, that also leads to hypermetropia. These are the four etiological factors that leads to hypermetropia. Clinical manifestations. So usually the patients who have hypermetropia, they feel tiredness of eyes, frontal or frontotemporal headache, and watering from eyes, and mild photophobia. Management. Appropriate convex lens in the form of spectacles or contact lens we can use to correct the hypermetropia. Surgical management is refractive corneal surgery, that is the laser therapy. So by using the laser or photo beams we can correct the corneal error. Then third refractive error is astigmatism. What is astigmatism? It's a type of refractive error wherein the refraction varies in the different meridia of the eye. Consequently, the ray of light entering in the eye cannot converge into a point focus but form focal lines. So the visual pathway or the visual light is not followed the correct way, that leads to astigmatism. So this is how the vision of the first image shows the vision of a normal eye and how the cornea is, and whereas in the astigmatism this is was the vision, that's a blurred vision. Etiological factors usually occurs due to unequal curvature of the cornea. Rarely it may occur due to subluxation abnormalities of the curvature of the lens. And types of astigmatism: regular astigmatism and irregular astigmatism. And management: cylindrical lenses in the form of spectacles or contact lenses. It is the best choice to correct the astigmatism. Surgical management: keratoplasty. So we are supposed to remove the old or affected cornea and replace with the normal one. Presbyopia. Presbyopia or eyesight, usually it happens in the elderly. It is not an error of refraction but a condition of physiological insufficiency of accommodation, which is leading to failing vision for near. So usually presbyopia happens the persons above the age of 40 years. So this is a picture, you can see the normal vision, the light enters, it will fall on the exact focal point on retina. So when comes to presbyopia, it will fall behind the retina. So they are affected with the blurred vision. Etiology: decrease in the accommodative power of crystalline lens with increasing age, leading to presbyopia. It usually occur due to decrease in the elasticity and plasticity of the crystalline lens, age-related decrease in the power of ciliary muscle. Clinical features. Typically, patients complain of slowly progressive difficulty in focusing the near object, while distant vision is not affected. Commonly, the elderly people used to read from a distance. So, that is what presbyopia. Management. Convex glasses of an appropriate power will be prescribed for presbyopia. And what are the diagnostic evaluation usually for refractive errors? Which are the various diagnostic tests we use? So as we learn for each and every conditions, history collection. So thorough, in-depth history, background information supposed to be collected. Then physical examination, we assess the vision test. Then Snellen's chart, ophthalmoscopy, retinoscopy, and autorefractometry. So this is also Snellen's chart. Usually we test the visual acuity, though in a distance, 6 feet distance, make the patient to sit over there and ask them to read from the different size letters. So based on that, they analyze the visual acuity, whether they have myopia or hypertropia or presbyopsy, whatever. Then retinoscopy, there's a direct visualization. Ophthalmoscopy, by using ophthalmoscope, they visualize the eyes. Then autorefractometry. So that is the automatically, there is a device, there is a device called autorefractometer, which device automatically measure the person's refractive error. So and determine, it will help to determine which type of lens supposed to be used. So we see what are the complications commonly seen with patients who have refractive errors. They have dry eye syndrome and epithelial abrasion and infection. Dry eye syndrome is limit, there is a loss of tear or the watering in the eyes. So it will seems dry. So because of that, they most often with the epithelial abrasions happen and infections. And nursing management. So nursing management, as you all know, is a common part of nursing care. So what are the nursing diagnosis patient of the refractive errors? What are the diagnostic nursing diagnosis patients undergone eye surgery? And what are the nursing management nursing care we supposed to provide? So with this I think, so with this I hope you understood about refractive errors. So basic of overview of anatomy of eye, and what are the types of refractive errors, and what are the manifestations we see on patients with refractive errors, and what are the diagnostic test and its management, finally nursing care. And hope you all follow that, and thank you.